at 70% attendance, it went down to 65%. And that is very worrying. It simply means that 35% of grade 12s are not attending school in Gauteng. And we are trying very hard to establish the reason and also to check whether we can't find them and bring them within the schooling environment. They can't be online because in Gauteng, you have to register to do online learning. You have to register to do homeschooling, and we'll share with you the figures of online and those that are doing homeschooling. It doesn't tally. It doesn't bring the 35% that we needed to have 100% grade 12. So it's a cause for concern, but we're putting some intervention mechanisms there to take the grade 12 to a permanent camp until they write the examination so that we can deal with the challenges of attendance. If you go to educators, it is more or less the same, but it's a serious cause for concern, and the reasons are there. We'll share with you why with this number of educators that are not coming to work. With grade R, we're at 69%, it went down to 64% attendance of educators. With grade 6, it went down from 71% to 65%. With grade 7, it went down from 75% to 66%. With grade 11, it went down from 74% to 68%. And with the matriculants, it also went down from 76 to 71%. This we will explain. At least we have an idea why this number of educators are not reporting for duty. We've got information that we'll share with you later on. When you take an average attendance between the period of the 8th to the 24th of July, that is before learners went for the break, you can see all the curves are going downwards, indicating that the attendance it's not satisfactory. So we've been below 70% averagely at all levels, and it's something that we're working very, very hard because we've invested a lot of resources on getting extra classroom, of getting PPEs, and of ensuring that the school nutrition is available. So this number of attendance may affect the investment that we've made in this regard. We can move to the next slide. If we can move to the next slide, I'll be excited. Unless it's my slide that, okay, thank you so much. There's the same recording of teacher attendance, and you can see that they themselves have never reached the 80%. We've been hovering just below 80%. As I said, at least this one, we have an explanation because we've got figures of teachers that have made an application to retire, to work from home, and those that have indicated that they've got comorbidities and they want to work from home. So we will share that information with you. We can move to the next slide. These are the numbers of learners that have applied to study from home. You can see that the total number of applications that we received are 790 learners. Of the 790 learners that applied to study at home, 446 were male and 344 were female. And as a department, we've got 192 applications that are still pending that we need to approve. For the first quarter, we've approved additional 31. We've registered 674 sites where learners attend because they don't want to go to a school, they want to go to home education center. So we only have 790 learners that have made the application to study from home from February until July 2020. So you can see we still have a large chunk of learners that we don't know where they are, and they've not shown up in even some of our online platform. We can go to the next slide. This is the registration of learners who were registered with the school first, but when we had the lockdown, their parents chose to keep them at home. We keep those statistics because they're very important for us so that we know where our learners. So we received 1,325 applications. Of the 1,325 applications, we've approved 300. We have approved 219, and there are 300 that are awaiting approval and those that are in the process of being approved by schools are 806. What basically happens now, so that we can have clarification, we've got 3 forms of schooling in Gauteng. The first form of schooling is the face-to-face one that I've shared the figures of attendance. The second one is what we call homeschooling, that is, parents are the one that are teaching the children. And the last one is lockdown education, which is the one that I've just shared, where learners are registered with the schools, but they are learning from home, like elderly people, they're working from home. So those are the 3 forms of education that we are supporting in Gauteng. We want to take you through the COVID cases that we have. If you check the graph that we're sharing with you, you can see that the graph was galloping. It was widening instead of flattening. It's an indication of what is happening in society generally. It's an indication of what was happening in Gauteng. So you can see that the numbers were increasing, especially from middle of June, from the 16th of June, we started to see that curve going quite high, and therefore we had lots and lots of positive cases within our schools. I will take you through the numbers in terms of learners, in terms of educators, in terms of our staff members, so that you can have an idea of the positive cases that we've reported in Gauteng. So we can move to the next slide. These are the figures as promised. We've categorized them in terms of region. That is Ekurhuleni, Tshwane, West Rand, Johannesburg, and Sedibeng. Those are the regions that we've categorized them. And we've also made it easier in terms of the district, so that you can know if we say Ekurhuleni North EN, where is that district? Ekurhuleni North, it's where I come from, Tembisa, Binoni, Captain Park, and those areas. So there we have 105 affected schools. We had 105 affected schools. Affected means they reported cases of COVID. If you take the total number of schools that reported cases of COVID, it's 1,776. That is out of 2,300 schools that we have in Gauteng. So out of the 2,300 schools that we have in Gauteng, almost 1,776 schools reported cases of COVID. In terms of learners that tested positive, we had 615 learners out of the 2.3 million learners that we have in Gauteng. We've got 2.3 million learners in Gauteng, and 615 tested positive. Out of almost 60,000 educators that we have, 1,487 educators tested positive. In terms of the staff members, we had 133 staff members of almost 28,000 staff members that are not teaching. That is, these are our non-teaching staff members, those that are working at offices and those that are working at districts, head office, and in some of our schools, but they are not teachers. So out of that number, it's only 133 that tested positive. In terms of our general assistant, we've got 55 assistants that tested positive. We've got 2,300 youth brigades that we've appointed to screen learners. Out of those 2,300 odd, we've got 19 that tested positive. The general assistant and the COVID youth brigades are a worrying factor, because this is the first line of defense. Everyone that arrives at our schools must go through them, and that's the reason why we are monitoring those figures. So in total, honorable members, we had 2,278 cases that were reported within the schooling environment. As I'm speaking to you now, we've got 218 schools that were closed. They were closed because they were waiting to be decontaminated. It's 218 schools. I'll rush the curriculum delivery, teaching and learning. Is just to give you a high-level understanding of the kind of support and teaching that we're giving to our learners. But let's start with the phases that came in. We started with grade 7 on the 8th of June and grade 12s as well. And then we accommodated grade 6 and grade 11 on the 6th of July. And on the 20th of July, we accommodated grade 3 and grade 10. So grade 7, 6, 3 at primary schools, grade 12, 11, and 10 in Gauteng. Those grades were accommodated before the president made an announcement of the break. So subsequently, the other grades that needed to come on, we could not bring them. So the other grades, that's grade 1, 2, 4, 5 at primary school, 9 and 8 at high school. There is a new gazette that was introduced by the minister. These grades will be phased in from the 24th of August. So, but all other 6 grades, we've managed to phase them in, including grade R. So let's take you through the academic support that we are giving to these learners so that we have a clear picture if learners are missing lessons or not. Let's go to the next grade, the next slide here. What we've done, there's something that is called ATPs. If you can go back to the previous slide, there's something called ATPs. ATPs are our annual teaching plan. So every year, the Department of Basic Education at head office give teachers their annual teaching plans, which simply means they are giving what they need to teach for that year. So that's the mandate of the national department, so that there is one curriculum for the country. So this year, because of COVID, it was practically impossible to follow the annual teaching plan. So they needed to be trimmed so that things that are not important can be isolated, so that you don't feed learners too much like they are robots. So you just pick up what is very important that will allow them to move to the next grade. And in that next grade, you'll then populate the part that was not provided in the previous grade. So that is very, very important. So from grade 1 to grade 9, those annual teaching plans were revised, mediated, and there were PowerPoint presentations that were given to our teachers. This came in various forms. It came in USBs or CDs, where people prefer CDs. It came in terms of exemplar lesson plans for teachers, exemplar PowerPoints, and exemplar worksheets. So our educators were given the material that they need to teach for this year, for the learners that are in grade 1 up to grade 9. This is very important because there is this element of pass one, pass all, or this element that we are overfeeding our children to finish the curriculum, or there is this argument that the year has been lost, so these learners must just stay at home and not be taught. But the revised annual teaching plans give us an understanding of what learners in South Africa have been taught, and this is very, very important. So I felt I need to spend some few minutes on it because it's a very important aspect of our education, because we are the Department of Education. We are imparting knowledge. That's our mandate. We are not a department of PPEs or availability of toilets and other things. Our core mandate is education, and therefore that aspect needs to be met. We are also giving you a summary of what we call school-based assessment. These are the tests, examination, classwork that learners have written, so that in case they can't write exams, we have a fallback. We have something that we can assess them. You can see where it's green, it means the performance is encouraging. Where it's amber, it means we need to do some additional work. And where it's red, it means the learners are struggling. And you will see that majority of the subjects that learners are struggling with are those subjects that we are told are difficult. We are maths, not the maths with a surname, not that maths with a surname. There's a full maths. You can see we've got 2 of our districts that are struggling with maths, and also the social sciences. You can see in EMS, you've got lots and lots of areas where our learners are subject. This is very important because in case the curriculum comes to an end or the year comes to an end, God forbid, we are therefore going to use this school-based assessment as a way of determining the capability and the learning areas that our grade 7s have acquired. So this information was correct as of the 24th of July. So I think that we might have moved substantially in those ones. So the next slides are just the same information, but about other grades. So you can move to the next slides, if possible. Can we move the slides? In terms of grade 12, we are also giving you a summary of all our districts where they are in terms of syllabus coverage, because we are monitoring this. It's a very, let's go back to the previous slide. It's a very important aspect, so that each and every district, we can monitor and tell you whether this district is struggling or this district is not struggling. So you can see, and I hope Chairperson are not going to say I'm picking up your language. You can see Chivenda, first additional language. Majority of our learners are struggling with it, and both Chivenda as a home language. You'll see as well as we move to the next slides that there are other subjects that we are struggling. Gauteng is the only province that have all the languages. We don't have the benefit of other provinces. For example, in KZN, you'll mainly get isiZulu, English and Afrikaans, where possible, Xhosa there and there. In Free State, you'll find Sesotho, English and Afrikaans. In the Eastern Cape, you'll find Xhosa, English and Afrikaans. But in Gauteng, we've got all languages, including Seswati. So we monitor that purely because if you fail a language, you fail the grade. So if you can't provide support for our learners, for languages, you will see that our learners will struggle. So it's very, very important that we monitor their performance. I've shared with you the revised annual teaching plan, so I'm not going to spend more time on this particular slide. It just emphasizes the work that we have done, and we want to thank the National Department for providing these guidelines. It's a very, very important aspect. These are the emerging trends that we've picked up. What are the things that teachers are complaining about? Teachers are complaining about time lost. Learners are also struggling with concentration. They really believe that the schooling environment is so concentrated now. They have to worry about social distancing. They have to worry about many other things. And this is bringing some psychological impact on learners. And also there are capacity constraints within our teachers, and teachers are extremely exhausted. And we thought that the break that we've given them will make them to come back re-energized. And some of our teachers, actually majority of our teachers, also have comorbidities. But to us, we are taking it as an opportunity to replenish the teaching profession by bringing young, dynamic people so that we don't have a teaching profession that is heavily loaded with people that are old, even though we value the experience. But I think there's an opportunity for us to bring young, dynamic people to the profession as well. Can we move to the next slide? This is the support that we're giving to learners. What happens is that all learners that are at home and they don't have computers or they can't learn, and they can't learn from your online platforms, we give them a 14-day cycle work. So their parents or learners come to the school, they take work for 14 days. It includes tests, it includes assignments, it includes homeworks and all these things. And after 14 days, they bring that work and we give them a new work for 14 days while we are marking the assignments. That is why we can give you figures of learners that have passed or learners that have difficulties with various subjects. So every 14 days, especially those grades that have not reopened or they've not come back. So they're not sitting at home doing nothing. We are doing what we call the learning activity packs. Every 14 days, we give learners that work and they bring it back, and teachers can also make assessment and determine. This is the area where we want to deploy those teachers with comorbidities that say they can't work, so that they can't stay at home doing nothing. They have to do this 14 work of marking scripts, doing following homeworks of learners and other things, so that we have teachers that are at school teaching not disrupted by those that are at home. We can move to the next slide. These are areas where learners can get the content which is available. This is additional content. The majority of this content is zero-based, so that even those that don't have airtime, they can get this kind of work. This is the work that we've done as a department on our own, and this is the material that is owned by the department. It's not owned by somebody. It's owned by the department and can be utilized by both parents and learners. In some instances, we've partnered with various companies Can you go to the next slide? There's the additional support as well that we are providing so that learners that are at home can also be in a position to access some of the work that we are giving. This is to demonstrate to honorable members that even those learners that are coming from poor backgrounds, they are not missing out, that we are putting additional support for them so that it must not be those that have resources or their parents have laptops that they can connect to learn, but we need to give support to learners that also don't have access to those tools or those devices. So it's just to give you a highlight and an understanding of what we are providing. So I don't want to bore you. If possible, we can move as fast as possible. Also, our special schools, this is very, very important to us because learners with special needs are the ones that need support more than any other person. So they must not be treated like second-class citizens or third-class citizens. Actually, these are special learners that must be given all the support. So we are demonstrating to you the support that we are giving to all forms of learners so that no one is left out on the basis of their disability. We can move to the next slide. These are the dates that or the information that we have provided for you to have an understanding of learners with special needs. Currently, there are 4,945 learners that are enrolled at 124 schools that we have in Gauteng. There are 9,000 learners that are expected not to return immediately because of underlying diseases or sicknesses that they have, and there are 2,178 learners that are expected not to return as well because parents feel that it's not safe for learners to come back. So we've given you the breakdown of the entire sector so that you can have an idea the size of this particular sector. We can move to the next slide. This is the additional work that we've given to them as well. We really want to ensure that we comply and we give them all the relevant support that is needed. But you can see there are some schools that could not reopen because either they were not part of the grades that the minister said they must come back, or were waiting for PPEs, or there was one form of vandalism or another. So we can move to the next slide. I said to members, feel free to stop me if you feel that I'm moving faster. This slide is very important. It paints the picture of the future of our educators. So those educators in Gauteng that are above 60, that want to leave the profession, there are 3,699. These are teachers saying, we've reached our retirement age. We really believe that we can leave the sector now. But we have to manage that because they can't just leave at once. Because if they leave at once, they will collapse the entire sector. You can see that of the 3,699 educators, 2,117 are teaching at primary schools at primary level, and 1,193 are teaching at secondary level, whereas 389 are teaching at special schools. So we have to manage how we release them. So in total, we have additional, I just want to be sure, we have additional 4,399 teachers that have comorbidities. That is, they've got underlying diseases that they feel that they can't make themselves available. And if you combine those that have are reaching the age of 60, the 3,699, and those that wants to leave because they've got comorbidities, you can see that the entire education sector can be paralyzed if this process is not managed carefully. And that is why it's within that context that thus far, we've only, of the 3,617, so 3,846 that have comorbidities, were only approved 1,360. Because the rest, we want to satisfy ourselves that there's no abuse, that people want to leave, because you have to recruit almost 6,747 new teachers. And that's a lot which simply means that you will have double parking, double pay, because you'll pay new teachers on a post of somebody that is sitting at home, not teaching. So our human resource budget will then start to suffer. So we need to manage this process carefully. That is why you'll find doctors are involved, and that is why you'll find that the principals are involved in ensuring that this process is done carefully. If it's not done carefully, it may collapse the state in terms of budget, but may also collapse the education system in terms of the non-availability of educators. So this is a very important slide, and it's very we monitor it every week because of the consequences that the state might face if this process is not managed adequately. We can move to the next slide. This is the number of people that have applied to work from home. In total, we received 4,399 applications from staff members that want to work from home. We've only approved 1,567. And the reason we have approved fewer is because to work from home, you need devices, you need data. But there are areas where even if you want to work from home, you work as a team. Let's take example, examinations. If you have to mark an examination script, you have someone must mark it and someone must check it, whether you have marked it correctly. But if someone is in Balfour Park and someone is in Soweto, it makes things difficult. So we are checking those things so that when we give approval to people that are not going to disrupt the system, but they're going to enhance the system. So of the 4,399, we've only approved 1,567. We can move to the next slide. And we've made these rulings. So there's no automatic provision of substitute for all those that want to work from home. There must be a process, and that process must be properly adjudicated, and there must be systems to check whether there's no abuse. Because if you don't do that, you'll have something called multi-grading of classes or small schools, or we'll have classrooms that don't have teachers. So we have to be very, very careful with this process. You can move to the next slide. Let's move to the next slide. Yeah, this important element, when we reopen schools, as I've indicated, out of the 2,300 schools that we have in Gauteng, 67 schools could not start because there was no water or less pressure in terms of water. We are happy to report that that problem has been resolved. So we don't have a single school in Gauteng that does not have water. But what we have a problem of load reduction. When you have a load reduction, when electricity switch off, because some of the water pumps use electricity, you find that we have problems of water being available. But in terms of water supply, the 67 schools that were identified, the bottom 67 schools that were identified that they didn't have water, they now have water. But there are schools that are experiencing, because there are big schools that are experiencing space challenges. That, as I said, we are 2,207 schools that have opened since 8 February. But there are some schools that have challenges, and there are schools that we felt that we need to give them additional mobile classes. There are 103 schools that we did that, purely because there was theft, arson, burglaries, and vandalism. You'll see vandalism is a common denominator in our schools in Gauteng. There are lots and lots of people that are vandalizing our schools. What for, we don't even know. We can move to the next slide. Here we're giving progress of the schools that didn't open and the challenges that they have. You can see in Ekurhuleni at Pumla Gardens, we had problems of vandalism and the water pipes were removed and the school ablution facilities were in a bad state. But as of the 12th of June, the entire problem was resolved. And we list all those schools that had problems. So I don't want to bore you. What is very important is that where there were these problems have since been resolved. We can move to the next slide. So we want to confirm that we had 351 schools that we have vandalized. We have appointed 351 contractors. And of the 351 schools that we have vandalized, 89 are now complete, but there are others that we are still attending to the problems. But the holidays that we had now assisted us to conclude that aspect. There were 6 schools that were burnt down completely. Of the 6 schools, we've given them 3 mobile classrooms so that it can serve it as an administrative block. Of the 6 schools that were burnt down, the areas that were targeted were mainly the administrative block. We're giving you a breakdown of the repairs progress thus far of the schools that we vandalized. So of the 351 schools that we vandalized, we are now averagely at 38%. I think, but now, because schools were closed, I can assure you we're hovering around 60-65% now in concluding the work that was done. We've indicated that we have mitigated space at 103 schools, and there are 6 new schools that are going under construction, but it's very difficult now because of COVID-related regulations. But we've got 6 new schools that we are building, and we also have schools that we are using alternative construction technology, ACT, for grade R, so that we can assist the grade Rs in terms of social distancing. Let's move to the next slide. Because of the disruptions that we had, because these disruptions are the ones that are making learners not to feel safe to come to school. You will recall at the beginning I shared with you the number of learners that are not coming to school. We have now partnered with the Army to assist us on 3 key areas. The first one is to ensure, because we have 2 youth brigade that screen learners. If you have a school that have, say, 1,000 learners in the morning, and they have to go through only 2 people to screen them, it causes delay and normally affects the morning classes. So we've requested the Army to assist us with mass screening, but also requested the Army to assist us with regular disinfection, because you've seen we've got almost 210 schools that they closed because they are waiting disinfection, and the Department of Health does not have
Chairperson and members, the screen seemed to be frozen. As we are waiting for the next slide, let me go to our approach on the infrastructure. On the infrastructure, we looked at our current infrastructure. That is the current hospitals. And the first thing which we did was to look at the wards and repurpose those wards differently, such that they can be able to accommodate COVID patients, ensuring that there's oxygen support in the wards. That's where I am. Yes, this is a very important part in the presentation. So we looked at our capacity, and we then looked at the planned beds and wards, where we repurposed a number of our facilities. I can go into details in the next slide. But then we then said that because of the number of beds which are needed, we needed more beds. We then opted to put alternative building technology within our structures, which could be of use post-COVID. For instance, at Jubilee, where the current hospital is old, and other hospitals. And having done that, when we calculated, we then thought we also need field hospitals informed by the models. And looking at what we needed and calculated on the field hospitals, we then appreciated that there might be an instance where the pandemic is very high, but that was the planning at that stage already. Next slide, please. Next slide, please. So basically, while we're waiting for the slides to change, yes. So in this slide, what we did, it's a very busy slide, but in essence, we used the number of cases which were estimated that there will be 25,000 beds at the peak, 25,000 will need general wards, 8,000 will need high care, and 4,000 will need ICU. Then we said, what do we require? And then we analyzed where we are, and we said, what can we plan and the gaps. So that went first for the infrastructure. It then went second on the blue on the top for the medical technology. We also calculated on the human resource which will be needed. For instance, we then said we will need an additional 3,802 nurses. We'll need an additional 91 doctors, etc. And we calculated the gap plan for oxygen, because we knew that this condition will need a lot of oxygen. We also planned for other key areas like this is just to share the planning which went through quite early in terms of the preparedness for. Next slide, please. Next slide, please. I think we'll have to then a number of slides which demonstrate and members can look at. I would like to, as soon as we are able to get, but I'd like to indicate that just on the progress of reconstruction and doing the additional beds, we were able to increase the number of beds which were available for COVID to 2,418. And then we added field hospitals. We all know about the readiness at Nasrec. Currently, it had initially 500 beds. then add an additional 1,000. We plan to do an additional 1,000 beds there, and we are also ensuring there's a down
Colleagues, can you hear the DG, the HOD?
No,
Colleagues?
yes, frozen, Chair. No.
Yes, because HOD, are you okay? Yeah, I thought it was only myself.
No, it's not only you, Chair. We can't hear the HOD.
MEC Mama Wulo, is he supported by some of the colleagues who can take over because of the, I think it's these connection problems now? MEC Mama Wulo?
Can I just check, Chairperson, and then can I just check and maybe we move to the next item if he doesn't come in the next 3 minutes, 2 minutes? Let me just check.
Can I ask the colleagues to have the comfort break for 2 minutes? Grab water, tea, while the MEC is checking on the HOD, please.
Thanks, Chair.
A tea will do, Chair. Thank you.
Thank you,
5 minutes.
Thank you.
5 minutes.
Yeah, it takes 5 minutes to prepare tea, Chair.
5 minutes, Chair.
Thank you so
5
much.
minutes, colleagues. Sure.
It's 5.
Yes,
5.
we said 5. Alipi, we
24
said
minutes.
5.
Okay.
Convening. 24 minutes.
All right.
Sure. Okay, over to you, HOD Lekele. Proceed. It seems as if, colleagues, can we allow Mr. Malotana to proceed then?
Anyone must proceed, Chair.
Yes, it seems as if the HOD has got a problem. Mr. Malotana, proceed, eh? Take over.
Thank you, Chair. I've just come back. I agree that my connectivity is a problem this side. Mr. Malotana can just take us through the next presentation on this current situation. I just wanted to just show the members our plans, and I think I was done with this presentation. They can just load for us the next presentation.
The next presentation, and can I plead with Mr. Malotana? Can you just take 15 minutes to wrap up everything?
Thanks, Chair. I'll do my best.
Okay, it's fine.
Chair, if you allow me, I'll start, and I'm cognizant of time. I will try and quickly run through the presentation. Thanks, Chair, committee members, MEC, DG, and colleagues. This slide, the members will be familiar with. This is the national picture that the minister releases daily. This is just to show that the strength of the pandemic on a national basis. Safe to say that nationally we've conducted over 3 million tests with 521,000 positive cases identified to date, with 363,000 recoveries having been identified to date, and over sadly with 8,884 deaths and 4,445 new cases reported. I think noticeably for the members is that if you look at the trend, the 4,445 has been the lowest in a while in the past couple of weeks. It's safe to say Gauteng remains the epicenter with 183,000 cases, followed by the Western Cape with 97,000 cases, and KZN as the third. This is just to contextualize globally the Gauteng province with the size of the population, active cases, and daily rate of infection. There is some degree of reduction in terms of daily infection. Gauteng to date registered 1,144 new cases, taking us to 183,000 active cases, with 51,000 cases active, and of course 2,313 deaths reported. The slide here, just if we can just slow down a bit. What is important for the members is to note that Gauteng has got 3 metros and 2 district municipalities. Most of our cases are confined to the metros, and Johannesburg being the hardest hit. In terms of who in Gauteng is affected the most by the pandemic, the males are slightly more than the females, and of course the age distribution of the cases is between the ages of 59 and 69, where the pandemic is felt the most. We can go to the next slide, and this next slide really just shows us where, in terms of the top 10 wards in the province, where the number of active cases per population. On the right side there just shows us that the vulnerable Unland Sinnoville area is the highest currently, followed by the Marshalltown, Johannesburg CBD to the south towards Kenilworth. And in terms of the sub-district, Johannesburg region D, E, F, and E are the hardest hit in terms of number of active cases per sub-district. We can go to the next slide. The next slide just shows us the pandemic timeline, meaning where we are from the 8th of March and to date in terms of the numbers. And I think we are still on the uprise, although the numbers recently has been a bit slower. So I'll then stop and just give a high-level summary of what the presentation is about. The next slide just gives us the summary. New cases today that are reported, 1,141. If you can go to the next slide. New cases, most of those cases are allocated to the metro. Johannesburg carries the most number of cases in the province, followed by Ekurhuleni and Tshwane. Noticeably for us is the number of cases that are increasing in Sedibeng. Of course, we are continuing to do our daily screening and testing. 109,390 people have been screened, and of course 1,865 tests will have been performed. In terms of what are the contributors to a number of deaths, the comorbidities of diabetes, hypertension, and of course retroviral disease are the biggest contributors. You can go to the next slide. This is just to geographically show that per metropole, Johannesburg has the highest number of cases, over 70,000, but Johannesburg contributes most number of cases, recoveries, active cases, and number of deaths, and of course followed by Ekurhuleni and Tshwane in that order. We are keeping a close eye in Ekurhuleni and Sedibeng recently, given the number of cases that they are having. Next slide. The next slide just shows the number of deaths that we are having in the province and where the most deaths are. If we can move the slide, those deaths are happening within the age group of 50 to 79 at the most. And of course, if I said earlier that the males in the province are slightly hardest hit than the females, but noticeably is that the age group of 30 to 39 are also starting to feel a bit of a pinch in terms of the number of deaths. As it relates to contact tracing in the province, we'll have traced 88,236, and of course contact that are being discharged that are no longer being monitors are 67,000, and monitoring 21,106, and most of those active contacts that have been traced, given the number of new cases, are in Johannesburg and in the Western. That's what that line is really indicating. In terms of screening and testing, if you go to the next slide, just because of time, we will have screened to date more than 12 million people, 948 to date, and have tested 329,554. If we can move the next slide, and then in that slide is also shows us the number of the work that is being done on daily basis. So if you can look on the 4th of August, you will see that 109,390 people have been screened, 1,865 people will have been tested. This is just in Gauteng. We've added what we call a 6th region, with district, which is correctional services. This is just shows that the type of work that is being done in correctional services in daily to monitor the number of infections amongst the inmates, staff, and of course in the prisons there are also they are mental health care users, they are monitors. In Gauteng alone today, we've had only 15 deaths, and most of them are officials of the correctional services, only 2 of them being 2 of those deaths being inmates. The slides just shows the quarantine sites that we have in Gauteng. Uniquely, we've got a number of quarantine sites that are managed by the province and the others that are managed by nationally. And as things stand, we've got a bed occupancy of 25.7% bed occupancy. So meaning we've got 4,837 beds that we can take anybody anytime for quarantine purposes. So we see currently sitting with 1,670 persons under investigation in our quarantine sites, and of course with 179 of those having tested positive. For the sake of time, I'll then just move to the number of cases. For case management, this will talk to a number of patients that are in our facility. If you go to the next slide, it will show us that in terms of patients that are admitted to date, we've got 5,887. These are patients that are confirmed, patients that are confirmed positive. Bulk of them are almost 50-50 distributed between public and private, but what is reassuring that most of those patients are really in general wards and room air, and nothing intensive. Most of those that are being ventilated or require any intensive procedures, 302 of them are sitting in private hospitals. And so we still have a bit of capacity for the number of patients. So in terms of where we are and the admissions that we have. If we go to the next slide, it is just what is our electronic bed management system that just shows you the dashboards that how we are monitoring the beds that we have in the province. This is a live system. So high level, it just shows us that we have 3,020 beds that are COVID allocated currently that are allocated. Of those, 2,545 of them are occupied, 546 of them are currently free. The distribution, 1,391 of them are sitting with COVID positive patient, and 1,154 of those are sitting with PUIs. And the distribution at the bottom of the screen, there shows you where the patients are. Leratong, Charlotte Matleke, Tembisa, and the list being instead for dealing with one patient. So this is just how we're monitoring and controlling our bed management. So in terms of the death, this is just a summary of those deaths where they've occurred. Public inclusive of homes, 1,125, and the rest of the deaths will have occurred within some sort of healthcare institution, the 1,143, giving us a total of 2,268 today. Just then the last few slides talks about the management of occupational health and safety and infection prevention and control. So this relates to the staph infections. If you go to the next slide, just to show that as last reported. If you go to the next slide, what is to members to really notice there is the number of infections that GPG health workers have, and those that are in the private health. At last count, GPG had 2,008, Gauteng had 2,899 infected health workers, and the private had 2,643, and national departments that had 2,275. The educators, the Msc of Education made reference to their educators' infection and learner infections that they've had. And of course, in Gauteng, we've got mines. There was in the beginning of May, we had quite an increased number of infection, and they have since stabilized in terms of the infections that are happening on the mine. They seem to have plateaued. Something seems to be working there. With the next slide, it will just present the same information differently, just to show that the highest number of infections here, of course, our GPG, our provincial staff workers, 2,800. So the slide is moved. But this is just a summary. But of course, in terms of this is the breakdown of health worker infection in Gauteng district per sector. We can see that we are almost equally distributed in terms of where the infections are happening, and in terms of the category of the staff between public and private, and of course the doctors versus nurses, and of course lay counselors and others, because that's really the distribution of our health workers infection. There is an intensive GPG OHS that is coordinated at the Office of the Premier that monitors the daily work in terms of the infections that are happening, and then of course the municipal workers that get infected be monitored and reported daily. So on a high level, with the time allocated, I think this is just the gist to just give a sense of where we are in terms of Gauteng's response to COVID as things stand. We want to stop here.
Let's interview.
Allow time. Thanks, Chair, and thanks.
Who's at the background talking? Mr. Arnold. Kalip. Kalip. Can you mute your mic? It's you.
Oh, thanks, Chair.
You can mute. It's okay. So those
Comrade Chair.
Yes.
Comrade, we also brought the MEC for Social Development just to give a brief report on the support we've given to the weak and the vulnerable during COVID.
Yes, that's what I wanted to do. Okay, it's fine.
Okay.
Where
Dr.
do
Mkheti.
we locate a report? Is there on any of the provincial report? Where do we get it?
It can be loaded. I know it was submitted, Chair.
Okay, it's fine. Let's load it quickly and hand over to the MEC for Social Development. Colleagues, did you receive the report?
Chairperson, I didn't receive any report from social development.
That's my
didn't.
point. That's
No,
my
we
point.
didn't, Chair.
We didn't get the social development one.
They must bring it.
maybe
Okay, it's fine, Chair. If you don't mind, Chair, we can take questions on those two reports.
So
while
can
we're
we
trying
say social development will deal with it tomorrow when we deal with the human settlement and COGTA, ne? Can we
Your
do
advice
that?
is appreciated. Yes, your
Can
advice
we
is
do
appreciated.
that? And can we make sure that that report is sent to us tonight? Because it's what we are missing on our part.
We'll do so, Chair. Thank you, Chair.
Yeah, so that tomorrow then we'll be able to deal with human settlement, COGTA, and also social development. So those are the two presentations, colleagues. COVID response plan, the health one, and the education report. So can we strictly deal with the ones that relates to the two? Then tomorrow we're gonna deal with the one social development questions if you have them, COGTA, and the other one is human settlement. So that we can be focused, colleagues. Can I see a show of hands who want to interact with the presentations? Keza? Who else after Keza? Switch on your video.
Hussein.
Hussein.
Opperman.
Mkalipi, Opperman. So, yes, so. Is it the 5 of you?
Hadebe.
With an age.
Yes.
Without age.
And who else? So that's far is the 6 of you. Keza, Hussein, Mkalipi, Opperman, So, and Hadebe with an H. Can we start with Honorable Keza?
Thank you, Chair. I will start with the presentation by the Department of Education. I have a few questions with regards to the method that they have used to appoint the construction companies who were to rebuild the vandalized schools. What is the process that they have used to appoint those companies? Because it was not clear in the presentation. Number two, with regards to the deployment of the army around schools, what lessons have the department learned from the recent killing of Mr. Collins Khoza? And if anyone gets killed around that place, what psychological impact will it have on children? And what should be the message to children if there are soldiers around them while they should be focusing on school work? What would happen? Who will be held responsible for if anything goes wrong through the deployment of the soldiers? Because I had hoped that there was a court process that was led by Advocate Ngaitobi, where he says this, that the way the soldiers are socialized, they are not given responsibilities in terms of human rights. Theirs is to neutralize the enemy, and the enemy in this case being the people of South Africa, and worse, to find them around school premises. It leaves a lot to be desired. What kind of decision that informed the deployment of soldiers, given the recent killings that we have witnessed and the conduct of soldiers. Why would you send soldiers, let alone Metro Police, who are also implicated in these atrocities? So I would like to know that so that you can explain to us what is that. Thirdly, I would like to ask, with regards to the reopening of schools, Msc, do you think that the reopening of schools contributed to the safety of teachers, learners, and non-learners against the virus? And if so, how so? If not, why are the schools being reopened and opened and so forth? Why are we continuing like that without a scientific evidence that points at whether we are ready to open the schools, apart from the fact that you are giving us a specific mandate of the department that you are dealing with schools and so on. And the other questions that the other question that I have with regards to education in the province is the fact that 60% in the country of teachers are female, yet 20% yet 20% are principals of principals are women, right? Is patriarchy raising its ugly head in education? How many female teachers are principals in your province? And what actions have you taken to change this situation? The other questions that I have with regard to the MSc, or rather the fact that I will move from education chair and go to the health department. The health, in terms of health presentation, chair, we have seen 135 million tender irregularity in Gauteng. How many companies were found to have used the deviation and emergency clauses in law to create emergencies where there have been no emergencies at all? So how many of them have done that? And what are the consequences in terms of their salaries and pensions, the people that are implicated? What measures, and the people that are officials, particularly who are working, who are involved in your health, in the health department, what measures did the Provincial Department of Health use prior the allocation of the stimulus package to deal with the corruption, and what consequences will you put in place for the officials that have been implicated in the lost COVID-19 funds to the tune of 2.2 billion dodgy contracts in emergency spending? Is there a forensic investigation for the allegations against Tuo Rhodesia, owned by former Minister Nomvulo Mukonyan's daughter Katlego, and 102 companies being probed and on the looting of 19? Why did the MEC for Health went to inspect graves? He was seen on social media inspecting graves there. I want to understand why was he seen in graves now, as if he's the MEC for death, not that of health? Why, in terms of the capacity of the hospitals to carry the load, are the hospitals able to carry the load of the affected patients, and the number of nurses? Are the nurses, the capacity is the capacity for the nurses that are that are physical in terms of dealing with that. Chairperson Frans Fanon called betrayal and broken promises as social treason. As social treason, he calls us to work towards new costs are those who did not count, those who were not recognized, and those who were and enthusiasm before the spectacle of the national flag floating in the wind are past. The people rediscover the first dimension of its requirement: bread, clothing, shelter, and of course dignity. So we would like to know the people that have been implicated in terms of many of the monies that were lost in COVID-19 in terms of the emergency allocations. I will stop it. I'll stop at that, Chair. Thank you very much.
Thank you so much, Honorable Kaiser. The next speaker on the line is Honorable Hussein.
Chair, thank you very much. I just have a few questions which I'm going to focus only on Department of Health, if you don't mind, which I find to be the more urgent one. And I might build on some of the questions that the previous speaker had raised. Chairperson, you'll remember that sometime in March, when the President first announced and addressed South Africa, and he announced the lockdown, the main motivation for doing so was to make sure that our health services have adequate time to be able to prepare for the impact of COVID-19, as there's been a number of projections at the time of what the peak might look like. Now, I think since March already, there was an expectation on the health department in particular to ready themselves for that peak. And I hear that the peak might happen in Gauteng sometime between September and October. But what troubles me about this report, and may I just pause at that point to say, Chair, that I appreciate the level of detail that has been provided by both the departments. It is refreshing to receive that level of fine detail, and it does give a sense of confidence. So thank you very much. But on the same token, what it does, providing that detail, actually exposes to some degree just how far behind Gauteng is when it comes to its own readiness for that peak. So I saw the one slide in particular about the number of hospital beds that are required and some of the interventions that you're making to procure new beds and new hospitals. But from the face of it, when you look at those presentations, I'm finding it very hard to believe that the province of Gauteng will be ready and adequately prepared when it gets to the peak. So if the department can maybe address that in a very direct question, and the question is simply this: can you give us the confidence that when you get to the peak, that you will have sufficient number of beds available, sufficient number of ICU beds available, enough ventilators available, and the necessary personnel to be able to address that the challenge that you're going to be, that you know that is coming very soon, and you don't have much time from now. So, and maybe, you know, because that slide didn't give us, although it gave us the detail, but it's also a bit confusing to work out exact numbers. Can you maybe just say, this is how many beds that we need, a total number, this is how many we are short? You're preparing some of the beds, but I'm not sure that that's going to be ready by the time you're going to get to the peak. So if you can just please expand on that. This is the number of beds we have, this is what we are short on by the time we get to the peak. And do you think that you will actually be ready when you get to that stage? If not, by what date do you think Gauteng will be ready to deal with the peak in all aspects? Chair, the second thing I want to deal with is this issue around the grave sites as well. We've seen these pictures that have emerged on social media and in print media and on television. I understand that there's been some confusion around apparently what was being said, and there's been some clarity provided. But what we saw, and what South Africans saw, was graves being prepared. Whether they've been preparing 1 million graves or not, or planning to do 1 million graves, the fact remains that those graves were being prepared. And what I'd like to know is just how many graves were prepared up until now, and what was the need for you to prepare graves when you already don't even have beds? And surely the focus should have been on getting more beds, and you're short on beds and ventilators and so on. What was the need for the department to be focusing on that area? And how many graves to date have been actually prepared? I gather that I certainly hope you haven't dug 1 million already, but if not, what number have you already provided for? And is that a contract that has been awarded to somebody to dig up those graves? Or is it the municipality that's dealing with it with our internal resources in government? If you can maybe just give more detail about that, because I think that there will be an active interest in that particular matter. We haven't had an opportunity to be addressed by the department on that, if you don't mind spending some time on that. May I just go back to the previous question as well and ask what is the stock of ventilators that the province has, and what amount do you think you will require by the time you get to the peak, and will you have enough to be able to meet the demand at the time? Chairperson, recently the MEC was placed on leave given the allegations of corruption in the province. I welcome the fact that some action in the meantime has been taken, and that there are investigations that are being conducted. What I would like to know is I'm told that there was a Gauteng Audit Services that conducted some form of investigation and produced a report, and that report highlighted a number of areas of possible corruption in the province and in the department. If you could please provide some very clear information of what exactly was uncovered, and how do you actually plan to deal with it within your province. Given that the MEC has been on leave, I also understand in the media as well that there's been a further 1 billion rand of purchase orders that have been suspended. And if you can maybe just comment on that, because those purchase orders were suspended, naturally because they are suspicious transactions. I assume that is the reason. How does that impact on the province's ability to have the necessary equipment to be able to deal with the pandemic in the province, if the purchase orders have been suspended already? And are there plans to make sure that there is sufficient provisions in place to get the necessary PPEs and whatever other items that need to be purchased for hospitals? I think those are just the questions. That's all the questions that I have. Sorry, Chairperson, just the last question. Chair, you will recall when the Western Cape was before us, at the time when they were the epicenter of COVID-19 in South Africa. And I think Minister Dlamini Zuma raised a good point at the time, and I wanted to borrow that from her on this occasion. And she asked the very relevant question and made the very relevant comment that part of the problem in a province is when the numbers are increasing, it's often as a direct result of a province's inability to identify, isolate, and quarantine people who test positive for COVID-19. And I take it that that's the similar reason why this is happening in Gauteng, and the numbers have been increasing at the rapid rate that it has. So if the province can maybe explain and provide some information to us on the efforts that they are investing in respect of isolating people from communities as and when they find them. I understand that you can't force people to quarantine, and I completely get that. But what measures then are you taking to make sure that those people within those communities are not spreading the virus even further, and making more quarantine sites available? From the figures that I see, I don't think that you have 100% capacity in your quarantine facilities. And is this an area that you're actually focusing on? Thank you very much, Chairperson.
Thank you so much, Honorable Hussein. The next speaker on the list is Honorable Mkalepi. I can see she's in already.
Thank you very much, Chairperson. Thank you very much, Chair. Thanks very much, MEC, for the presentation. I will start with Msc of Education, MEC Panyaza Lusufi. The numbers that you gave us here is worrisome. That is for the teachers, staff members, and learners who have contracted the virus during the first phase of going back to school. And the teachers who are 60 years and above of age, who have applied to your department, MEC, because they are very scared to go and teach during these difficult times. So therefore, I would like to know what is your plan, because if the number is true, that suggests that is about 3,699 applicants from teachers who are above 60 years of age, who are saying that no, they want to leave because they can't go to school and teach. Definitely sure it will also disorganize your department. So therefore, I would like to hear your plan in this regard. And I think one of the presentation, I'm sure it's health, also touch regards to the peak that is said that it will come around 1st of mid-August and to September. And I'm just worried about this news because the schools will be open on the 24th of August. And it seems as if, according to the presentation of the document, when the school reopens, it will be the time of the peak again. And if the department also can shed some light, what is the plans around that? Because it's not a good story to tell. Also in your presentation, MEC, you spoke about infrastructure backlog, which I think also is a very problematic one. And I'm sure as an activist, you saw a video that was posted by the spokesperson, the first spokesperson of the EFF, Dr. Komsam Wisenindlu, before the 6th July, where the school was supposed to reopen of the Bopilong Primary School. I'm not sure about the school, but it's in Val. And I'm sure that you saw that video, Minister. And the video was not an impressive video. It was a very, very bad state of the school. So therefore, in your document, you talk about 103 schools that are also helped through containers. And I'm not sure if such schools is part of the one that I'm mentioning of Komisam Hussein in Ndlozi, because if you go back to that video, I'm sure even the chairperson of the portfolio committees and the members saw that video. That was shocking. If any school in Gauteng is in that state, and if the MEC can share with us, how are you going to address such backlogs which affect the primary schools with no proper toilets, of which COVID-19, it needs running water, and if the toilets are not the one that is inspected, how are you addressing that matter? I'm sure it's not the only school that I'm referring to. There are so many schools that are in that state. And on the issue of corruption in the department, if the MEC as well can also share with us as the committee, because it seems as if there is a report that spoke about 3 schools whereby there was a judgment given by the South Gauteng High Court after Iskhumbuzo Secondary School, Solwazi Primary School, and New Generation Combined School approached the South Gauteng High Court demanding 15 million subsidy funds for their 3 independent schools. It seems as if the department is aware, because the department head, Edward Musiwe, wrote an email to MEC, the good MEC Panyaza, on the 29th of May, confirming that the money for Isikhumbuzo Secondary and Solwazi Primary, a new generation combined, had been released. However, the school's lawyers have disputed these claims. So I'm raising this because it was also in public since it went to court. So I'm asking myself, Msc, how many such cases you have in your department? Maybe this one is just a tip of iceberg. So coming to the health department, I think my colleagues have asked the one that was also on the news, dominating the news. As a result, that's why we have an acting health MEC by the name of Jacob Mamabulu, my colleague from YCL. So therefore, if the head or the leader of delegation can also take us into conference, because it also sends shocking waves to the nation that also include the MEC of health. Uguti, how can an MEC and the partner and all that are involved in such things can happen during this pandemic? And the department, maybe the head of delegation can also update us with how far, because I'm sure the nation is also watching this portfolio committee. And maybe if the acting MEC, who Jacob Mamabulu, can also update us. There was also some bad news that was also on the media about a person who wrote on Twitter by the name of Shomisani Lethole, who wrote to the Minister of Health before he died and said that in Tembisa Hospital, he died because he was not given food. And if the department have done the investigation in that regard, and what is the way forward? And did you also talk to the family of this person who died under these difficult circumstances? Because I think it will be only fair just to go to the family and to say to the family, we are sorry with the department, because no one must die in the hands of the hospital if a person go there with a hope that he's going to get help. Also, the Tembisa Hospital and all other hospitals, like many hospitals in Gauteng, they are not. We do get some reports that they are not in a very good state of affairs, whereby we expect that during COVID-19 there will be something new. But before COVID-19, the health department in Gauteng, we are receiving bad reports. For instance, in Dr. Yasu Dadu Hospital, a patient by the name of Kukuletu Makuneni from Kagiso, who came to the hospital to give birth, and the treatment was bad in such a way that she was waiting for a long time in the passage until her baby died after she gave in the baby. And she tried to engage the department. We tried to intervene as well as members of parliament and activists, but I'm sure that you can get an official report here, because it's not the first and the last report that you are getting from the Department of Health. So it's not a good story to tell as well. Thank you very much, Chairperson. Let me just stop there to allow other colleagues to take some questions.
Thank you, Honorable Mkalipi. The next speaker is Honorable Opperman. Over to you, Honorable Opperman.
Thank you, Chairperson. I'd like to ask MEC Lusufi through you, how much has vandalism damage cost the department to date, or at least for the past 6 months? And how have you dealt with those schools reporting dry boreholes and poor water pressure from the local municipalities? To health, currently 102 companies are being probed for COVID-19 looting in Gauteng alone. How has COVID-19 related tender corruption affected the province? And I'd also like to know, even before the pandemic, billions were being looted in the health department alone. What steps have the province taken to recover those funds? And currently circulating on social media, there's allegations that you spend 13,000 Rand per bed in the Nezrec Field Hospital. You bought 1,000 beds for 13 million Rand. And there's also allegations that you spent 18,000 Rand just on wall clocks, meaning you bought 40 wall clocks for 450 Rand each. Are you investigating the Nezrec Field Hospital? And how much truth are in these allegations? Thank you, Chairperson.
Thank you, Honorable Berman. Honorable Tou. Honorable Tou.
Yes, thank you, Chairperson.
Can you put
Let
your
me firstly,
camera on? Can you put your camera on first?
it doesn't work. I've been trying. Can you hear me, Chairperson?
It's
Hello.
okay. Yes.
Okay. Yes, Chairperson, thank you very much, Chairperson. Msc for Education, yes, I worked with you and I worked very well, 100% with you. I can see that you are very much careful and committed with the entire school plan progress. My Chairperson?
Yes, proceed. We are listening to you.
Yes. Yes, Msc, I can see that you are very much careful and committed with the entire school plan progress and processes in Gauteng. And for that, we thank you very much. Well done. But there were teachers that complain about time lost because of COVID-19. The question is, did you develop a comprehensive intervention in drawing up a program of becoming more responsive in all timetable
is that from Auditor General audit outcomes, there has been issues of misuse and abuse of public funds. So such calls were made earlier before the fund could be spent, including our president, His Excellency Matamela. He made a call that the funds ought to be used for its intended purposes. Now, I'd like to get an understanding from the department that what are the internal control measures in place to avoid abuse of these procurement processes. Over and above what National Treasury has issued as regulations, can we get an understanding what processes and criteria was used in selecting these companies that benefited? We've had a very shocking and disturbing allegation that an official will sit in the office and go through the list and choose whichever company that he or she thinks should benefit. So there's an opportunity for the Gauteng Department of Health to allay such fears and give us a detailed understanding of the process and the criteria that was followed, given that we're under the emergency, but certain checks and balances ought to have been conducted. So if we can get that understanding. The other issue that I would like to get from the department, how often do they get to monitor to ascertain whether or not these internal control measures are effective? And have they seen a need to review the internal control measures based on their assessment of whether such internal control measures were effective or not? From these funds, Chair, how many Black SMMEs have benefited? Can the department quantify the local content in the procurement spend? How much was imported? Also, can you get an understanding that was there an issue or investigation conducted that ascertain whether or not there were no inflating of prices? Were there issues of fronting? And how far are they in terms of ensuring that what we have seen and heard on the media in terms of perceiving the internal control as non-existent, how far have they gone to address such a shortcoming? Thank you, Honorable Chairperson.
Thank you. Thank you, Honorable Khadebe. Thank you so much. Mrs. Panyaza and Mama Bulo, I think you'll all agree with us as a committee that in this democratic government since 1994, this is for the first time that because of this pandemic, when huge amounts of monies were dispersed without without an open tender process. You will all agree with me that there's never been a period where government acted outside the provision of Section 217 of the Constitution, which calls for procurement of goods and services, a system that is fair, equitable, transparent, and competitive, and also cost-effective. As I said earlier, we must commend the swift action by your Premier, who then moved swiftly in a sign of commitment to anti-corruption, transparency, and openness. But then where we are seated, in May, the Premier himself, he was on record saying that he has submitted all these matters of the government to the SIU. Here, between the two of you, how far is this from the recent development that we've seen happening over the past weekends? So those are the issues that one wants to raise. But then the other issue that one want to raise is whether yourselves as a province have a strategy to ensure vigilance beyond the state of disaster based on the 6-pillar approach that was shown to us. And then also the issue that one needs clarity about is your post-COVID-19 economic recovery plan linked to the Gauteng City region framework. I think the other issues that one wants to deal with is around the issue that the colleagues have raised around the issue of the grave program that was launched somewhere by the MEC in North Pretoria in a graveyard there. Then also the MEC has been on record that they are ready for 1.5 million graves as a province. Then the issues that ones want to raise on this one is that maybe for you, the two of you, how does the health portfolio then go to do with graves? Also the issue to say, are we not then seen as if we are not responding to the pandemic instead of providing beds, providing ventilators to hospital, because also in terms of the loss of people, especially the health personnel, including the teachers that we are hearing that have lost their lives on the line of their duty as well. Why then should we then be focusing on graves instead of making sure that we provide adequate facilities, PPEs for our doctors and the nurses and all those frontline staff that we seem to be losing, than to then focus on the graves? Then the other issue that we expected to raise with you is with regard to the expenditure. Is with regard to the expenditure in relation, apart from the ones that are being picked up in the media space, in relation to your relevant portfolios now that you lead. I see MEC Mama Volo, apart from you leading acting MEC, you are leading a particular portfolio department. Are we making sure that we're in line with this, and then there are no issues that are going to come at the end of this? They will just emerge as they're emerging, because we are said as Parliament, we need to, as we do oversight, we must also be briefed on the expenditure pattern, whether they are done in line with the Treasury circular as the Honorable Khadebe has raised. So basically, this is my issues. Over to you, MEC. Oh, the last one on MEC Lusufi, there is a slide that deals with the positive cases in schools as per 24 July 2020, where in per district, I'm worried about Sidiben. You said the affected school were 27, but on the closed school, the number then is 32. Was it supposed to be 22 or 12, or is just a typo error? And then maybe not knowing the regions of Gauteng. There's a region, I think it's Johannesburg South, where there's no single school that has been closed, but they were affected by 73. Is it based on the geographical spread to say mostly where these numbers are high? Like in Tshwane, you have got 279, Tshwane South, if I'm not TS, it might mean Tshwane South to me, 279 affected school, and then that's why you've closed 32. And then maybe for you to explain this variance in terms of the pandemic, is it also based on the densification or where the schools are located? Those are the issues that I wanted to raise. Over to you, MEC Lusufi, then it will be MEC Mamavulo in that order.
Thank you so much, Chair, and let me thank members for the questions they've given us and the words of encouragement that they've extended to us. We don't take that for granted. We truly appreciate that. Chair, let me clarify the issue of the Army. It's still an engagement with the Army. We are concluding a memorandum of understanding. I think it's in the presentation, and we're quite clear in the memorandum of understanding or cooperation is that there must not be any military action against learners.
MEC Lusufi, is there no any way that you can improve your light? I'm told you're on TV, the nation can't see you, they want to see you.
Is it better, Chair?
Let me see. That will sound a bit better, yes. Then you switch off the video. Honorable MEC Lusufi, can I please unmute your mic as well?
Am I audible? Am I audible?
Yeah, but you've switched off your video now.
Yes, I've switched it on. Apologies if I'm darker. It's because of nature, Chair. It can't go beyond here. If I was born like this, it's like this.
Chair,
Yes.
Chair,
Yes.
I'd raise my hand.
Who's raising the hand?
I'd raised my hand much earlier, about 30 minutes ago.
Who's raising the hand?
Is David Maimel.
David Maimel as the Chief of Staff. David Maimel as the Chief of Staff in the Office of the MEC for Health.
No. We don't work like this in this committee. You are a support staff to the MEC. Whatever you want to raise it through the MEC. The MEC Mamavulo is here. So this is how it goes here. That's why there was a delegation of officials who must present. We've passed that. If there are issues that you want to raise, Mr. Maimela, you do it through the MEC Mamavulo. I think it's the acting MEC for health. Proceed, Honorable MEC Lusufi.
Thank you so much, Chair. I was clarifying that there is a process of finalizing a memorandum of understanding with the Army. Reality is schools have been disrupted in our province, and reality is that the law enforcement agencies indicated that they've got a backup of the Army as per the regulations that have been published on how the Army should support the police. So it's not a choice, it's the support, because we went to law enforcement agencies and that's the package they gave us, that the Army will also assist us. So they made an offer. It's not that we approach the Army, and on the basis of the offer, because we need assistance, we have put a memorandum of understanding. And within that context is that they must not harass learners or attack learners or harm learners. So we'll monitor that situation when the final memorandum of understanding is finalized. And we'll share it with the committee if the committee would want that aspect. So we don't want to go on the history of the Army, the conduct of the Army. What we need here is to ensure that everyone is protected, the facilities are protected. I think you've seen on the report, we've got 351 schools that we've vandalized. We can't just leave it. They need to be protected, and we really believe that all law enforcement agencies need to assist us with the protection, and therefore, if the Army and the police are available, including the Metro Police are available to protect facilities, we'll be the first one to appreciate that. Obviously, we are not ignorant of some of the things that they've done before, hence the memorandum of understanding that we want to engage them, explicitly indicate that they must not harm learners, must not harm students and other things. Besides, I mean, what they're doing, I really believe it's a courageous job to sanitize our school and also to ensure that they screen learners and also ensure that where there are cases, because they've got a medical team, where there are cases of COVID, will also be in a position to provide support. So it's not about skit and donor. It's about support that they need to present to all of us. So we really appreciate that. Member Kanya also raised the issue of closure and opening of schools. I'm a proponent of schools being opened, and I'll give you reasons, Chair. Within the schooling environment, learners are screened before they enter the school premises. Before they enter the classroom, they are also screened. There is social distancing. They wear masks. There is sanitization. They get school nutrition. They get knowledge. If the schools are closed and they're at home, only the few continue to get those benefits. A majority of our learners don't get the benefit. If they're at home, there's no social distancing. If they're at home, they're not wearing masks, some of them. If they're at home, no one is giving them support in terms of either school nutrition and other related matters. So our children are better off within the schooling premises. We really believe it's an investment that needs to be protected. Obviously, we are guided by experts, and if experts believe there will be another wave, and if experts believe that learners must be at home purely because there will be a wave, we'll listen to that and we'll respect that kind of a decision. But from the academic point of view, we really believe majority of learners are better off within the schooling environment. And those that don't want to be within the schooling environment, we've made processes available, the process of homeschooling and the process of lockdown schooling. And majority of learners are taking advantage of that. So the opening and closure of schools, I don't think it's harming the schooling environment. But unfortunately, we are fighting a virus that we didn't know almost 4 months ago. We are fighting a virus that is invisible. We are fighting a virus that we don't know how long it will last. So it's going to be a trial and error process. No one can give us definite answers on anything. We don't know how long will be this virus. We don't know whether next year still be here, 2022 still be here. So we need to maneuver within the available space. And I think we've tried very, very hard to ensure that we maneuver within the available space, and therefore it affects us. I don't have the figures of the number of teachers that are female, that are principals, or the number of female teachers. I know that the last time, I think it's 2019, 2020, we're at least almost 50-50 in terms of the number of female educators and the number of male educators, and also in terms of representativity at the principalship or SMS level. But I'm not sure in the last 2 years whether those figures have changed. And I'm very proud. I'm one person that believes that women need to be given respect, need to be promoted, need to be also given opportunities, not on the basis that they're women, but on the basis that they're doing very well. And majority of our schools, to be quite frank, majority of our schools that are led by women are doing exceptionally well. So it's within that context that I honestly feel that they need to be given opportunities to run some of our schools. I'll come back later on the issue of graves, Chair. Remember you said, I think I'll end up on the issue of the graves. Let me continue with other issues that were raised by member Kalipi. Indeed.
Msc,
Yes.
Sophie, those ones that are behind you, can you tell them to play a bit far away? They are interfering.
Let me do that, Chair.
You can ask them to play away from you.
Apologies, Chair. It's here.
Yeah. Yeah, isn't that they hardly see you, so they will always see you.
And it's
yes, we
time.
understand. Yeah.
It's story time for them, so they're waiting for Daily to say some stories to them. Apologies.
Okay.
That's why you must open the schools.
Definitely support that.
Honorable Hussein Order.
Member Mkhalif, indeed, the positive cases within our school premises are worrisome. What comforts us is that even the Department of Health have acknowledged that the virus spread is not happening within the school premises, it's happening within our communities. So these cases are not COVID cases found in our school premises. These are cases that are found through our screening. When people arrive, when we screen, we identify that the temperature is high, we take to an isolation point, and we find that that person is positive. Or it's somebody say, I can't come to work because I've tested positive. So that's what encourages us. But indeed, to have this number of learners testing positive and number of educators and staff members testing positive is worrisome. The over 60 years applications are massive. And if we can't manage them properly, I really believe they're going to give us difficulties. So you need to stagger it. And you stagger it using various criteria. We've got 5 criteria that we are utilizing. One is replacement easily. If replacement is easy, for example, if somebody is teaching life orientation, we really believe that that particular person can be replaced. If that person is teaching mathematics, for example, it might be very difficult. If that person's comorbidities are indeed real and difficult to manage, that person can be released. So we are not releasing them at once. There are some criteria that we are utilizing to determine whether those people can be released or cannot be released. And we are working on those aspects. And that's the plan that we have. That's the plan that we've put on the table. Yes, there is a peak that we are anticipating. We've persuaded the national minister. You will see on the new revised calendar that there is another break that learners will get. I think it's around September, October, I'm not sure. But there is another break that learners will get so that we can manage the peak. So we've incorporated the peak on the basis of the advice, and we've put that additional time. And we really believe that additional break will assist us to deal with it. We are quite aware we've extended the academic year towards the end of December, I think the 15th of December for matriculants, and the results for matric will be released around February next year. So at least there is a breathing space that we have that is assisting us to manage the situation. Let me deal with the issue of infrastructure and the video that was circulated by your commander. The reality is that school was battled many times. The reality is that school was burned down. The reality is that school was deliberately vandalized. The reality is those people that were opposed to the reopening of schools targeted some of our schools, and in most instances targeted the sanitation and the water, knowingly that it will hit a maximum damage on the basis that the COVID matter is related to water, is related to sanitation. But I'm proud to announce that we've fixed all those schools, including that school that we are relating to. I don't understand why some people will go to a public school and throw stones in a toilet seat and expect government to take blame. It's unacceptable that in all the instances where there is vandalism, people have deliberately targeted toilets and people have deliberately targeted water services. But as I said, we've repaired all those things. All our schools are now functional, including Kudlotaro. We don't have a problem. We are also repairing the area where the school was burned. So it was a school that the community declared war against that school. And sometimes it's impossible to accept blame when the same community is the one that have declared war against their own school. They are the one that burned the school, they are the one that vandalized the schools, they are the one that have broken inside the school and stolen various things within the school premises. But as I said, as I'm speaking to you now, all those issues have been resolved. I'm aware of Skumbuzo. I'm not aware of the other two schools that we have related. And just because this matters now with the court, I'm very reluctant to deposit my thoughts and my thinking on how we need to do. But I can give you a general statement. Remember, it is not automatic or compulsory to subsidize schools. Those schools that need subsidies, they are basic minimum things that they must do. And one of the things that stops us from funding schools is the issue of the utilization of the funds that we provide to that school. If they can't account for those funds, we can't release the funds. But also, if there are whistleblowers from the school that indicate that there are things that are not correct at that particular school, we'll also not release those resources. But the three schools, I will check them, Member Kalipi, and I will be in a position to give you feedback if there is a need for us to put that in writing as well. We will come back on the issue of the acting MEC and other related matters that you raised, Member Kalipi, when I sum up before I give to MEC Mamabulo to speak on those issues. So we'll clarify the acting part and the current actions that we are taking as provincial government on matters related to the Department of Health. Member Opperman, I don't have figures, but I can tell you, vandalism is costly. We really believe there is a deliberate campaign by those that are opposed to the reopening of schools to deliberately vandalize our schools so that their views can be heard. It's costly, and I can tell you it runs into lots and lots of funds that need to be deposited there. So we'll consolidate the figures and share with you as soon as we get those particular figures, including the issues that we've raised about dry boreholes and low water pressure. Metro, thank you so much, ma'am. I miss you as well. I mean, I worked nicely and closely with you. I was actually comforted when I saw your name here, that I'm not lost. I'm still in your company. You honestly took care of some of us when we were new in the legislature. You guided us rather than abandon us, and I'm humbled that I'm still in your company here. Teachers that are complaining about time lost, I think it was prior to the change of the academic calendar. Now that we've changed the academic calendar, we really believe that will accommodate some of them. But the reality is that we've lost almost 3 months. We've lost almost 3 months, and that is why we needed to trim the curriculum, but most importantly, change the annual teaching plans so that we can accommodate this reality. But let's hope that with the amended timelines now, we can be in a position to respond to some of the concerns that teachers were raising. We're giving them study guides, yes. We're giving them radio lessons, television lessons. We're giving them PowerPoints, presentations. We're giving them lots of support so that at least they don't have to struggle to deliver those lessons. If there's something that worries me, is the 35% number of learners that are still not back at school. We can't afford to have this kind of a situation, especially in our country. Our skills base is minimum. The only way to fight poverty and the only way to fight inequality and the only way to ensure that our children don't miss out on opportunities is through education. It's not through social grants. So if they can't get education, we're going to revert back to the situation that we want to rectify. So if we have this large number of learners that are at matric, that are not at school, we should be worried as a country, and we are worried as a province. Hence, we felt that we need to stabilize our schooling environment so that people are not intimidated to come to school. We need to ensure that our online support is there. We also need to ensure that those without computers are also given work to do. So we are monitoring that situation very closely. It's something that needs our immediate attention. Member Khatib, I'll come back as well on the issue of our procurement abuse. and related matters. I think I'll deal with that issue later on. Chair, I've taken a note of the issues we've raised as well, and I want to highlight the one that we've raised about the graves. I think on behalf of the Gauteng government, we need to apologize to our people, to society. I think there was a serious miscommunication on the issue of the graves. And we have no reason not to apologize to our people. It was wrong, completely misunderstood, and completely unacceptable. We can't use anything to justify it, nor can we say something to register our disappointment. We are disappointed in the manner in which it was communicated. Reality is Gauteng government does not have a policy or strategy on digging graves. What we communicated was that we wanted to consolidate the number of graves that are available from all our municipalities. I think in that process, the message didn't go well, and for that we apologize. And we will not have words to justify, and I don't think that we want to justify it. We are sorry. It was communication went wrong, and we really believe that culturally, those that we communicated this thing about graves and it affected them badly. Here we are as Gauteng government, and we're saying unconditionally, without any conditions, we are deeply sorry. We don't have an agenda to bury our people. We have an agenda to heal our people. We don't have our agenda to throw people into graves. We have an agenda to ensure that people go home because we've given them the necessary medication. And for that, we apologize. So I don't want to justify it or say it in any other way or format. And I think that we'll find it in our heart to also accept our apology. In terms of the MEC chair, the Premier took that decision, and on the basis of the decision that the Premier has taken, the Premier also made arrangement that the law enforcement agencies, in particular the SIU, must go through all the accounts. We've given them 4 weeks, between 4 weeks to 6 weeks to go through those accounts. We are pleading for patience here. There is a clear amendment or relationship that the President also signed that allows the SIU and other law enforcement agencies to go through all the accounts. And they must go through all the accounts. And I think there is no single account that we say is not going to be touched. And within 6 weeks, we'll be in a position to share with you that information. But if you want us to share with you that information now, it's going to be practically impossible because we don't have. It's a process that we believe needs to be sorted out and need to be concluded. And we need experts, and we need people that have the legislative mandate and the power to investigate these accounts. And I think that dealing with those particular accounts. But for now, as a provincial government, we have taken a decision to monitor all the other related accounts. And I think there have been reports that some of those particular accounts have been stopped or they've been investigated, and we're in a position to deal with whatever that we need to do. What we have done now, because we centralized the work of PPEs in Gauteng with the Department of Health, now we've decentralized it back to all departments so that the responsible line managers, that is the HODs, can take full responsibility for this kind of work. So we will, when we get those reports, share them with you and indicate that this kind of reports or whatever that have happened, we'll be in a position to give you a report on how we've dealt with those particular issues. I want to leave it there, Chair. Sorry, I want to leave it there, Chair, and leave it to MEC Jacob Mamabulo to deal with specific health matters together with the HOD if there are areas that he wants to. Thanks, Chair.
Thank you, MEC Lusufi. Over to you, MEC Mamabulo.
Thank you very much, Honorable Chair and members. Let me. I don't know if you can hear me, Chair.
MEC, can you please put your camera on? We haven't seen you since you joined this meeting.
Amategwani, Chair.
Kalipi, there's MEC Mama Bulo. Can you see him, Kalipi? Proceed. The Madeva now the MEC.
Okay, to optimize the volume, Chair, I'll prefer to close it if it's okay, so that we can have a good quality voice coming out there. Now, Chair, the first thing, Chair, I would like to say is just to apologize on what happened from our side. Sincere apologies about that earlier challenge problem we had. I really want to profusely apologize. But secondly, to reaffirm your intervention, Chair, you were absolutely right, and thank you very much for that intervention. And I hope our apology will be accepted. We'll make sure it doesn't happen again. The second issue, Chair, is
there's nothing to worry about, MEC. That's why I said you are the line of authority. Whoever wants to raise things must do that through you, unless they're delegated by yourselves to do such.
Thank you very much. Now, the two things I would like to say. One is that I think Msc Lesotho has dealt with the issues that both yourselves and members raised, particularly around the graves, the issue of the graves. And I think, let me just confirm and reaffirm what Msc Lesotho said. And we will definitely get that behind us and focus on the task of saving lives of our people. So I think Msc Lesotho dealt with that issue. Let me just confirm that, yes, in terms of fighting corruption, I also want to welcome and sincerely appreciate your positive feedback about the Premier's very detailed and comprehensive address he made last week on Thursday, in which he really reaffirmed the position of the provincial government to root out corruption. And that the matters currently, all of them relating to COVID-19 supply chain, logistics, and procurement, are well firmly placed in the hands of our law enforcement agencies. And at this point, Chair, would like to appeal that let's allow the law enforcement agencies to deal with these matters and deal with them decisively. We have confidence that we will get to the bottom of this issue and we'll be able to deal with these issues promptly and swiftly. And I'd like to assure members about that. The other issue, Chair, that I just want to raise is that I have just since I was appointed and starting on Friday, Saturday, Sunday, and we finished today. We visited about 26 institutions, health facilities, and this includes the 2 storage facilities for PPE, one located in Centurion and the other one located in Roodepoort, where one has clearly seen what is happening with PPE, where is it, its availability, and understood the issues around PPE. I would like to assure members that we are also dealing with this matter. I know the DG is also in the meeting. She also visited the 2 facilities that are dealing with PPE. And following this challenge that we have had in the province, I can assure you that we will make an announcement on this issue on how we're going to comprehensively deal with this matter based on my observations and those of the Director General in the province. But there's no doubt, and the Premier has said it himself, we will as a province make sure that the distribution and allocation of PPE to our health workers and workers in general across government departments is done in the most efficient and effective way. And the particular and specific details of that, we will announce them and we can send out reports to the committee on just how we are going to deal with these matters. Once we have consolidated our reports just in tomorrow and Friday, I'm quite sure, Chair, I want to commit that we will update the committee. I commit myself to do that on how we are going to deal with this matter of PPE moving forward to make sure that we can protect the workers in the provincial government and those in the front line. The other matter that I just want to comment on is that having made observations in the hospitals, and I just completed this today, and HOD can speak to that issue, I'll ask him to come in just now, is that we are ready for the peak and the storm that is coming in the period that has been announced based on the scientific models that have been done. And where there are still challenges, I'm quite sure that we will be able to close and tighten up the loose ends. But honorable members can be rest assured that the provincial government will be able to manage the peak period. And there are issues about HR capacity, infrastructure, devices and equipment. There are matters of PPE itself. And I'm quite sure that we will be able to make sure that we respond adequately to the challenge that is facing us in the next few weeks. So to that extent, Chair, I just want to ask HOD to speak to the questions about the beds availability and the issues of supply chain lists. If and those we can submit them, Chair, formally in writing as part of the information. I would want to ask that you permit us to send you the list of these companies, and I commit to do that. I'll email it to your office, Honorable Chair. And I just want the HOD to speak to the issue of beds and any other matter that he might want to speak to. I'd like to delegate him, but only and exclusively the HOD. And also, Chair, if you don't mind, the Director General is in the meeting. If she wants to say something, I'm pleading that you allow her to say. But otherwise, Msc Lesofie has well covered the issues that have been raised. And at this point, let me ask HOD to just say very few points, and then the DG if there's any. And just before, Chair, can I just say to Honorable Mkalipi that I'll give a call offline about our YCL matters. She's still welcome to come back. She's our product, a very good investment we have made. And we also have the right of recall. But we will take off that line, and I'll give you feedback about recalling our member from where she is now. This is our product, this is our investment, and I can assure you we will get back what belongs to us very soon, before the storm.
Order, National Coordinator of YCL. Order.
There's no orders in this meeting, Mukalipi. You know that we don't do orders. We deliberate on matters here. Over to you, HOD.
Chair, you are not neutral on this matter.
It explains her behavior, Chair. Now I can understand why.
Yeah. Let's allow the HOD to respond to issues as delegated by the MEC, please. HOD.
Thank you. Thank you, honorable members, and thank you, MEC, for allowing to answer the question on the availability of beds. What
I think your network.
We had required in terms of the critical, which is the ICU and high care beds, on the 6th of
HOD, you seem to be having a very serious network challenge. Eh?
Am I audible? Am I audible?
That's better.
Am I
You
audible?
must stay put.
The chair,
Now
yes,
you
now.
stay put. Let's hear again. Let's try.
Can the chair hear me now?
Yes, you stay put like that. You continue like that. Okay, proceed.
Thank you, Chair. With regards to critical beds, by September, beginning of September, we according to our model, we required 2,400 beds, and at that time, we moved from the current 373 beds, and we have now 2,378 beds, meaning that we calculated that will be 22 beds short. But I want to implore on the members that this disease is changing. The treatment is changing. The number of ventilators which we need are less because our clinicians are now using a different method, especially with the introduction of dexamethasone. So we are confident that in terms of the ICU and high care beds, we are ready. In terms of the ward beds, we had estimated according to our model that we'll need 7,500 beds. And with all the intervention which we've made, the gap indicates that there may only be 3,000 beds, which may be shortfall. But then we've compensated those by including what we call the fever tents, and also we are strengthening all our CHC, that is services. And we're also strengthening the services of the private practitioners in our various wards to come into this space. So in other words, we believe that with the preparation, we are ready and we won't be short of beds, especially with the fact that we increased with the field hospitals at Nasrec and the field hospital, which is going to be at Tshwane. And we've identified another hospital in the city which will be available for us to use. In terms of the next question on controls, right from the 17th of April, we then started putting controls after a letter was written to audit committee to assist us, where we separated the role of payment and the role of supply chain, and there was already an established provincial supply chain, which was chaired by DDG supply chain from the provincial treasury. We also established the bid evaluation committees, which was chaired by people out of the Department of Health, and the bid adjudication committee. And the MC has indicated the controls at the warehouse were also improved. MEC members, I think I will stop there. Thank you.
Chair,
So
can I
HOD, can I allow
just,
the
please, Chair?
Yes, MEC?
Yeah, can I just say, I thought HOD will also speak to these issues of what happened in Tembisa Hospital, the incident that happened, and the one in, I think it's in Gauteng.
Yes.
Can I commit to go and investigate this? Honorable Mkalipu was asking if we visited the family. At this point, no, I'll check, but I commit to visit this family and we will send a report on the investigations. I just didn't want to leave these two issues, but we can ask DG to say something. I'm sorry about that. Yeah.
And then HOD local, are you able to give feedback now that the MEC has just been appointed to act on the matters as raised by Honorable Mukalipi, failing which then will follow the line that the MEC is proposing. But I think HOD, this is information at your disposal. I see on the other matter you even issued a statement disputing what was said by that patient before the DG. HOD, look at it.
Thank you, Honorable Chair. Can you hear me, Chair?
Yes, I can hear you clearly.
Can the Chair hear me now?
Yes, you are loud and clear.
Yes. Thank you very much, Chair. On the Tembisa, would like to share the report with the committee, but it was thoroughly investigated, and is a lot of correction in the information which was presented. With regards to the investigation on the twins and at Chris Hani Baragwana, it's a process which we have initiated the investigation, and the results of that investigation will also come through, as we have already found that some of the articulations were not truthful. Thank you very much, Chair, and thank you, MEC.
Okay, that's the matter that the MEC then will carry forward and share with us. DG of the province of Gauteng.
Good evening, Chairperson. Good evening, members of the portfolio committees. Evening to the MECs from Gauteng and the colleagues. Chairperson, there isn't much really that I'd like to add. I align myself with the points that have been made by both MEC Lesufi and MEC Mamabolo, just to underscore the fact that we were very concerned about the control environment right from the beginning of the implementation of the COVID response. So a number of control mechanisms were put in place over and above the traditional ones that would have existed in the departments. So for instance, we appointed other CFOs and some DDGs to support the CFO in the Department of Health. We ran the internal audit reviews as a matter of oversight of our internal controls to check whether our internal controls were working, and it was during that process that we discovered some of the problems. So the areas that we had requested that be reviewed, especially by the Gauteng Audit Services, was food distribution and food parcels. There were lots of issues in the atmosphere around that. It was the issues of donations plus procurement. Right at the like within a month of the project starting, we reviewed those, and it was done just purely in the interest of good governance and ensuring that our controls were working. And where they were not working, we discovered what the deficiencies were. And in fact, that led to the forensic investigation being instituted in May, with the SIU taking a site around the 4th of June to investigate, and they have been investigating up until now, although they haven't given us reports. So as undertaken by the MECs, once those reports have been availed by the SIUs and others who are investigating, the information will be shared with the committees. I thank you, Chair.
Thank you so much, DG. Thank you so much. Then colleagues, are there follow-up questions?
Kalipi.
Okay, it's the three of you thus far. I'll start with you, Hadebe.
Thank you, Honorable Chairperson, and to honorable colleagues in Gauteng. Chair, I am mindful of the fact that some of the issues are before the SIU. As such, it will be practically impossible for us to get a detailed response. But my question, Chair, was in relation to the internal control measures in place. I'd ask whether or not, especially in the Department of Health, do they have adequate internal control measures in place to avoid what was highlighted as potential danger, that of the abuse of COVID-19 funds. If there were such internal control measures in place, how often were those reviewed? I even asked Chair that we were told, we heard over the media of instances where an official will sit in front of his or her computer, go through the list of service provider and just pick one and appoint. Whether or not such reports are true, if not, can we be given an understanding of a criteria and a process followed in dealing with emergency procurement over and above what was issued by National Treasury as regulations? How did you ensure that the price or procurement systems that were utilized, ultimately resulting in the service provider appointed, those price that you received were a price that are cost effective? Is it not just a case of one looking on the list and choosing the name that he feels comfortable with? So I would like to get such an understanding. A detail, yes, I agree, Chair. We can wait for a detailed response from the SIU. But for now, because things are continuing, there will be other goods and services that are going to be procured. There will still be a need for appointment of service provider outside the normal procurement processes. We want to be comfortable as this committee that moving forward, there are measures in place and they are system adequately to curb what transpired and what is there in the public domain. I think that cannot wait for SIU to give its outcome. It's something that you ought to have put in place now if you didn't have in previously. So I want to get that understanding, Honorable Chair. Thank you.
Thank you, Honorable Khadebe. Honorable Hussein.
Yeah, Chair, thank you. I just wanted to show appreciation for the apology that MEC Lesufi had made on the issue of the graves. And may I just say that, you know, I think if more MECs and ministers in our government have to apologize in the manner in which he did for the mistakes that they make, I think our country will be in a better place. So I appreciate the manner in which he's done it. I think it was humble of him to do that, and I appreciate that. You know, when this matter emerged, Chairperson, and it's not my intention to keep the item alive. I accept, you know, the explanation that's provided. But there was also a second part to this issue around the graves, which was the perception that was created in the public domain that this thing around the grave sites that were being dug up was an opportunity created for some company to get a tender. So not only were people, you know, angry about the fact that a government was digging up graves rather than buying beds, but the perception that was created was that this thing was about creating some opportunity for a company, which is why I asked the question, you know, just how many of these things were dug up, and was it done by a contractor, or was it part of a tender, or is it just the municipality doing the thing? So I think that the MEC Lesufi must, if he can just explain that part, and then we move on from this point, so that at least we have the sense of confidence that, you know, the matter is under control. If it was a tenderer, so be it. And if it's being investigated, well, that's also good. But at least that information, I think, he must kindly share with us. But I thank him for the response in which, in the manner in which he has responded on that matter. Thank you, Chair.
Thank you very much, Honorable Hussein. The next speaker is Honorable Mkalipi.
Thank you very much, Chair. I know and I also agree that the MEC who's acting as an MEC for health can't have all answers, since he is acting But I think that he can also take us into confidence of what happened today in Mamelodi Hospital's chair. I have put on the group whereby the resident barricaded the major streets due to power failures that has not since been attended to. So I think because it happens while he is in Msc, I'm sure he will be privy to the information. My national coordinator of the YCL. And then secondly, I know that Msc Lusufi will also come back as a leader of delegation. Msc, I agree with Honorable Hussein that we are in an Msc who is very responsive. Whenever we send you SMSs to say, please intervene, there is a child who's out of school, you just respond and you act. But I think that there was, I don't know, maybe you forgot or I don't know what happened because it's unlike you. On the message for the 28th of June, whereby a name of a young person, Morkane Mutudi, who's a student at UJ, who was also sharing his story, which is very, very, very bad. And then I ask you to intervene. I know that the MEC who is acting as an MEC for social development is coming tomorrow. Maybe if you have forgotten to intervene in that child, and if you can also send that SMS as a form of intervention to that MEC tomorrow, can also update us, because that child, she wants to continue with his studies as he's studying in UJ, studying engineering, but his mother does not have a house, and also she is not even renting, and they are living behind the CC church. And sometimes they don't have electricity in order to charge his gadgets in order to assess his studies. I think that one is also very critical, MEC. Those are the two items, Chair, that I wanted to make a follow-up on. Thanks very much.
Thank you, Honorable Mkalipi. There is a slide that strike me. It's with regard to our correctional facilities. I think as the HOD was presenting, he made reference of the death of 2 correctional officers. I think MEC one has got interest that maybe you can then do a breakdown of all the correctional facilities in the province, and in terms of the number of facilities, so that you are able to look at that as part of the information that you are going to submit. The other issue which we believe is attributing to the increase of infection and death of healthcare workers is the lack of poor quality PPEs. I'm glad that since you took over office on Friday, MEC Mamavulo, you've been making rounds to understand this. So it's our view that there is a need for a robust quality assurance measures on the PPEs being procured. And then we are told that the mere fact that now already there are over 150 healthcare workers and nurses that have succumbed to COVID due to the lack of poor quality PPEs. I wanted you to respond to such allegation, but nevertheless, seated here, I just got something from a specialist practitioner who's saying that I think you must hear it to MEC Mamavulo, that you sound promising and enthusiastic, and then you are bringing hope to the profession. Be as it may be, can you then deal with all these issues that you have been raised by the colleagues in that order? I think I'll start with you, Honorable Mamavulo, and Mr. Lusufi will come after you.
Okay. Thank you very much, Honorable Chair, for that positive feedback. I'm deeply appreciative of that warm words of encouragement. We will do our best. Now, I just want to say that I agree that the issue of the robustness and effectiveness of our internal controls to deal with the issues that have actually came out in the province, particularly those controls in dealing with supply chain, procurement, logistics, and actually oversight on those have proven beyond any shade of doubt that we need to deal with them. And I'd like to assure members that we will go, and I don't think we should be defensive about this issue or try to put it anyway. We will go back to the drawing board and look at internal controls as prescribed and defined by the Public Finance Management Act, including the Public Service Act as it relates to human resources. And I think one of the issues that we will immediately look at is also the effectiveness of our governance structures that are made to prevent very proactively loopholes, leaks that lead to collusion, to fraud, to corruption, to theft, and generally undermining PFMA, wasteful, irregular, and all those cohorts that are dealt with by PFMA. So one of them I would like to just assure members that we will conduct a quick audit on in the next few days is our own internal audit capacity, because that is one instrument provided by PFMA, which in terms of proper governance will be able to help us see the risk, including the risk audit, risk profile of the department. So these are matters that we will look at. DG dealt with some of them, and I think this is one area that we will definitely look at. We are also the issue of the coordination of auditor AG's office, SIU law enforcement. The Premier has spoken about conducting lifestyle audits, even of ourselves, and the senior leadership of the department. All those interventions combined, we will look at them, but at this point, I think the low-hanging fruit to look at to scan the environment to protect the department, procurement in supply chain, is to look at the effectiveness of internal audit function, and that is the most immediate one that I want to assure members that we want to look at and just check with them how did things fall into cracks. So that's one matter, and one matter that I want to assure members that we will look at and see the levels and areas of exposure that may actually cause problems. So we will make sure that we close all the leaking taps whilst we fight corruption, and people that have been that will be found to be on the wrong side of PFMA and any other legislative controls. We will deal with them without fear of favor or prejudice, and we'll deal with those issues decisively, and that's what I'd like to assure members. Chair, PPE, in actual fact, we are appointing what we call PPE champions, which is a directive that the Minister of Health, Dr. Zweli Mkhize, has given 2 days ago. And in the province, we have started to establish those champions. And there are other controls and systems. One is working well at Charlotte Maxeke, which helps actually to deal with this issue of PPE from quantitative supply, availability, accessibility, quality assurance, and also making sure that there's proper accountability on the PPE. So there is best practice that we will introduce to make sure that workers are not vulnerable. Let me also assure members, in Centurion facility and the storage facility or warehouse in Centurion and Rio de Port, we have adequate supply of PPE. I can assure you, I can confirm quantities of PPE are adequate at the current moment. The problem is distribution. And of course, when we deal with these issues of corruption, we will have to look at Those companies that are found to be on the wrong side of supply chain policy, obviously we'll have to confront that, but I can assure you that with the quantities that we have stored in these facilities, we will be able to transition to a proper process without compromising the current operations. So on that, I think members, we should be able to manage the transition from where we are into a much more better, efficient and effective environment on the PPE matter. As I did say, the violence that happened in Mamelodi today, yes, it was about electricity in the city of Tshwane, and community members took to the streets. There was a perception that it was about taxi problems. That has been clarified, corrected, and actually the Mamelodi Amalgamated Taxi Association has issued a statement clarifying that. And I can assure members, the police, law enforcement, the taxi industry and stakeholders have opened the routes. The matter is cleared. Tomorrow we're looking forward to a much more stable operation in Mamelodi. We're not anticipating any problem. So to that extent, Chair, I hope I have tried to deal with the issues, but the reports that we have committed to give to members, we will definitely do that. And I still commit to do a visit to the Tembisa family that Honorable Mkalipi raised. But otherwise, Chair, let me leave it here. If there's any matter, HOD can come in. But otherwise, we're looking forward to improving the robustness of accountability and make sure that we uphold the Constitution, as you say, Chair, and the legislation regulating our work.
To respond with regard to the quality and quality assurance of those PPEs that might be in stock. That's the matter that need to be looked at, because there's an allegation to say, though they are there in numbers, but the quality leaves much to be desired. But it's the matter that we can look on.
Yes, Chair.
Revert back to us on this one, because the numbers might be more in stock, but the quality is what the health professionals are complaining about.
Yes. Yeah. That is true, Chair. We'll deal with that matter.
Msc Lusufi.
Thanks, Chair. Let me start with the issues that were raised by Member Mkalipi. I can see that the date you are referring to, Member Mkalipi, that's the date I was instructed to be in isolation. So I really apologize. I'll indeed pass the request. I've gone through the request. I think we'll attend to it. Apologies that we took time to respond to that one. Member, you say it's very difficult to indicate whether there was a tender for the digging of graves. Let me tell you why, because this responsibility lies with local government. Municipalities are the one that have a mandate to dig graves. So it will be extremely difficult to know whether they were doing it using their own staff members or they were outsourcing it to other service providers. But it's the information that we can get and share with you. What we wanted to emphasize, and I think we are appreciative of the acceptance of our apology. What we wanted to apologize is that we don't have a strategy or a program as government, especially as the Gauteng provincial government, to dig 1 million graves. It's not in our plans, it's not part of our plans, it's not going to be part of our plans. So if there was this communication breakdown or miscommunication, we once more apologize for that, and we will make a follow-up on the issues that we've raised. We really believe that the focus and the energy now should be directed to ensure that the Department of Health succeed. I think the Premier was very clear that the issues of the PPEs and the issues that are now in the public domain concerning the Department of Health has taken us backward on the work that we've put to ensure that we push back the virus, but most importantly, we flatten the curve. But now that we've put systems, and now that there is an acting MEC, and now that there are law enforcement agencies that are investigating these matters, we really believe that we should now channel our energy in ensuring that we indeed flattened the curve, but most importantly, be ready for the next wave if it comes, in terms of the number of beds, in terms of the support to the doctors and those that are working in the health sector, and most importantly, to assure our people that when they come to our facilities, they will get help, and we will work around those issues. Member Khatebe, I think MEC Mamabolo tried to explain the internal control measures that we need to strengthen. The mere fact that we are in we are occupying front pages of various media houses and we are hitting the headlines, it's quite an indication that there are limitations. So we need to go back and close those limitations. If you check the institutions that have been given some of the work they need to do, some are in the advertising, some are in the construction, some are so it's quite clear that there are gaps, and I won't even question the citation that you are giving, that someone would just take a decision where they are, that I'm appointing this company. So we need to close those gaps. But in dealing with these matters, which is something that I want to caution to all members, we must not reverse our desire to ensure that legitimate, good companies are given the work by government. And we must refrain to paint everyone who has provided services as corrupt. And we must not fall into the temptation that unknown equals a good tender, the known equals a bad tender. Because if you take that stream, I really believe that will reverse the gains of empowerment, will reverse the gains of ensuring that the markets are open for everyone and that there's no domination through race or wealth of a certain sector. Because I can tell you from where I am now, when you see this kind of things, you start to say, hey, maybe I must have a certain CFO of a certain race. I know that the Auditor General won't question me. I know I won't get the question from the newspapers. I know I'm not going to get a question from the legislature. If I appoint this kind of a person or appoint this kind of a company, that is why. So I'm saying what we need to do and what we need to emphasize, let's provide opportunities to all South Africans that are capable, talented, and they've got the capacity. But if it takes a shape of race and it takes the shape of who has the financial muscle, I really believe that it will exclude other people. So it's just a caution, so that we don't paint everyone as a bad person, but those that are bad, we must hunt them, we must be merciless to them, and if needs be, they must bring back the resources that they've taken from the state. So there we must not be apologetic, but we need to caution that if we paint everyone with a certain paint without going deeper into details, we'll miss an opportunity of ensuring that these opportunities are given to all our people. I want to leave it there, Chair, but thank you once more for the opportunity, and thank you for giving us this time for us to share what we are doing within the province of Gauteng. I think we'll see you tomorrow if time permits, Chair. Thank you once more for the engagement. Thanks.
Definitely, we are going to proceed tomorrow, and it will be good that the two of you MECs and the DG and the HOD still attend tomorrow's proceeding, because these matters are interlinked, and it will be good to have you in the meeting. Colleagues, we've already exhausted Parliament time by almost 37 minutes. We are still proceeding tomorrow. Can we end it here? Then we'll meet
yes,
at 6.
Yes,
we'll meet at 6 tomorrow.
Thank
If there are
you,
issues
Chair.
that they are not adequately addressed, the two MECs will still be here with us tomorrow. So that
yes.
brings us to the end. That brings us to the end of tonight's meeting till we meet at 6 again tomorrow. I want to thank everybody who has made time to attend this meeting. I see Dr. Tau is amongst us. TM Bapella joined the meeting later after we started and then asked to be excused. But we must congratulate our colleague, Honorable Grunewald. He tendered an apology. He has just been blessed with a baby girl some hours ago. So these COGTA babies are adding numbers now in COGTA babies. Good night, everyone.
Good night, Chairperson. Thank you.
Thank you, Chair.
Thank